Thank you very much, Madam Deputy Speaker. I initially want to touch on new clause 49 as, like other members of the Bill Committee, having sat through hours and hours and hours from September to November, that this is suddenly pounced at the last minute when it is such a complicated new clause and has not been interrogated. It is quite clear that the government's original spin that no one would pay more than £86,000 for social care and no one would have to sell their house is completely misleading. All the accommodation costs are on top of this. As has been highlighted in the media and by members in the Chamber, those with assets of about £100,000 will not see any real gain from this policy, while those sitting on assets of £500,000 or more will keep a lot of their wealth. That means it exacerbates the differences and penalises those in the north of England and areas where house values are not so high, and basically is feeding the frenzy down here of people sitting on overinflated house prices. As has been said, not levelling up, just doubling down. The cap only applies to personal care. This means things like washing and dressing, which has been provided free in Scotland, both within the care home and in home care since 2002, was expanded in 2011 to provide more hours so people with greater need could stay at home longer, and was extended to those under 65 with care needs in April 2019. Scotland's the only UK nation that provides free personal care, and we see it as an investment that we spend 43% more per head on social care in Scotland, but an investment in people's independence and their inclusion in society. The problem is we spend far too much time talking about social care just as a burden, instead of actually seeing it from the point of view of the user. The Scottish Government already added an extra penny on taxation for medium and high earners to cover things like our well-being policies or health or social care. But this government's plan to increase national insurance contributions will disproportionately hit low-paid workers and young workers. And I would say the biggest weakness of all that we know from the original debate on the national insurance change is that the funding is not going to go to social care initially. It's going to go to the NHS, and yet it's social care that is in crisis. This is what's causing the pressure in accident and emergency, because people who are ready to be discharged simply can't be, as the care support isn't there. So I don't think that this fixes the problem. There will actually be very little money, because a lot of it's going to go on capping the overall payment. I don't see social care benefiting from this at all. And yet it's social care that needs investment more than anything else. Turning to the main substance of this bill, which is meant to some extent, unpick the damage and fragmentation of the Health and Social Care Act less than a decade on, I wish to express support for Amendment 9 and Amendment 72. Many in the NHS, including myself, will be glad to see the back of Section 75 and forced tendering. Others in this chamber know that it was the Health and Social Care Act that brought me into politics, as I just couldn't believe anybody thought what they were doing was a good idea. But it is still clear from the pandemic that this government are absolutely wedded to outsourcing services to private companies, and to the flawed notion that somehow financial competition drives up clinical quality. I'm sorry, that just simply isn't the case. As the Chair of the Health Select Committee has just highlighted, you actually have to focus on safety, on clinical audit, on peer review, if you want to drive up care quality for patients, not just the money that's in the system. The government appeared to have conceded that integrated care boards should be statutory bodies, as health boards have always been in Scotland. But the partnership boards can include private providers, such as we see with Virgin Care in Bath. As the partnership boards will be involved in devising the local strategy for health services, this is likely to lead to a blatant conflict of interest, and I do not see any resolution to that. The NHS simply should be the presumed provider of health services, not just as the Shadow Health Minister has said, because the NHS is in it for the long term, not just for a quick contract. But it's the NHS that provides the training to nurses and doctors who are the vital workforce of the future. Private providers, frankly, don't do that. Private providers largely live off the NHS, as well as not training staff. Patients where there are major problems or complications inevitably end up in the intensive care unit of an NHS hospital. So in closing, for all the size of the bill and the scale that this reorganisation will still be for staff in the NHS, who we all know are frankly exhausted, the government have failed to take the opportunity to repair fully the damage of the Health and Social Care Act and to recreate in England a unified public health system, as we're lucky enough still to have in Scotland.